My name is Solomon Kahuma. I work at Guild Digital. We are a software organization that works with nonprofits and startups to support them in designing and developing digital products and solutions that support their missions for impact. So the story that I'm going to share is for a project that we recently took on, which was in Kyaka 2 refugee settlement. Kyaka 2 refugee settlement is located in Uganda, in the district of Chegegwa in Midwestern Uganda. The partners on this project were Famamundi, who were the main funders, and African Humanitarian Action, or AHA for short, who were basically running the program. The goal of the project was to design, develop, and deploy a CHT tool to be used by VHTs to deliver services in that refugee setting. Next slide, please. So what we did is we developed the RVHD app, which was powered by the Community Health Toolkit, or CHT, customized to support the health services in this area. The model we adopted was the TOT model because we believe that our program partner, AHA, would help with delivery of training, or facilitating of training, because there is an aspect of translation, because the VHTs that we work with predominantly speak Swahili and French, or a mixture of both languages, which comes out to be Lingala. The refugee VHTs are from Congo and Rwanda and Burundi predominantly. So those are the languages they were speaking. So our program, the program team from AHA assisted with that bit. The data that we produced from the tool is being visualized using Superset, which is an open source tool. So far, we have trained about 26 VHTs, supported use cases such as ANC, PNC, ICCM, WASH, and we're planning to add SGBV and stock monitoring. So these use cases are basically the two extra use cases, which is SGBV and stock monitoring, were included because in the refugee camp, that's something that's predominantly looked at by most IPs or partners. So it's something we're currently working on with AHA to produce a workflow in the CHT app for our VHTs. So data collection is ongoing. So far, we have registered about 2,000 households with a population of about 11,000. And yeah, I can say data collection is currently going on well. Next slide, please. So what are some of the challenges we faced? One of the biggest challenges was around language barrier. This adds to the delivery time because during the training, you have to have a pause for translation. During that time, there is also the fact that because it's a new language and they don't speak the Swahili that's spoken, let's say in the 3 other countries in East Africa, we do have to find a way of translating most of the workflows to that language for them while they're training. So making sure that they understand the workflow. So also the other thing was the gaps and differences in workflows of similar service areas. So partners design their work in a way that they have programs and goals in those programs. So the workflows, remember, are developed in the CHT, are developed according to the standard, standard ICCM practices. So finding the, let's say, sweet spot for both of them to be applied in the CHT app is something we're currently working on. I can't particularly call it a challenge because it's actually something that we're excited to take on, but still came up as a challenge because when we scoped it, it popped up and it wasn't something we had looked at. Of course, there's logistical challenges working in the camp. Things like connection, power, and things like that come into play. And sometimes, of course, when you need to go and see your user, the roads to some of those places are quite impassable, but we did manage through that period. Next slide. So what are some of the lessons we learned in the refugee setting? So we learned that we need to look at peer support and learning on a multilingual level. So making sure that the users understand what we're telling them about the app, but also we're able to give them support and train them properly to understand the workflows. So far, this has been something we have taken on and are doing quite well. And I think they found that it was easier for them to learn the workflows in English rather than taking it on in the language. But still, translation is something that we're looking at. So there's a variable experience across the board right now. When it comes to translation, some people are comfortable speaking their local languages, but the rest of the people who find it a bit inconveniencing to again have things translated for them, we're taking the path of learning a new language. So we have found variable feedback in terms of language and how the current forms of workflows are organized. Then the other thing that we learned is that smartphones support inquisitive and intuitive work with digitization better than other forms of digital learning. So we also found that they found it easier because a smartphone is something that they interact with a lot. So it was easier for us to deliver digitization through a smartphone than any other form of digital learning. So that's something we also learned from that program. Then program refreshers for service areas also help to strengthen digital roadmaps and workflows for the VHTs. We found that it was important for us to have those refreshers with them because one, they first of all come from another country. So some of the workflows in those countries differ. I can give you an example. One of the VHTs told us where one of the vaccines was applied, the site was different in Congo and in Uganda. So having a program refresher helps them understand how that works here. Then we also look to support VHTs with localized guides to reference post-training because the workflows were new. So we figured continuous feedback and continuous understanding of the workflows was important. So we provided them with localized guides and they were able to continue referencing this. Then also supervision is very important for sustained results. In this kind of setting, you have multiple IPs that are reaching out to the same VHTs that you're training. So it's important for you to continuously supervise them and understand what they're doing, but also ensure that they are able to produce the data or the information that's required. Next slide. So what are the next steps for us? One of the next steps and important step for us is to support the scale up of CHT to other refugee sites or camps in the country. This is something that we are looking to do very soon and seem to be our direct next step. The other one is to co-design and develop service areas such as stock monitoring, sexual and gender-based violence in the app, because I think these are areas that are new, but okay, stock monitoring is not new per se, but making sure that we can be able to co-create and make sure that we can move this to, we can have it in the app and it supports the programs that are run in this setting that we're applying the application to. So the other one is to continue working with the CHT community, share learnings and collaborate with the community. Already we have had a lot of support from Anthony on this, but also because we're using Superset as a dashboard builder, we also would like to interface with some of the people in the community who would like to start using Superset or already using Superset, so that we can try to make these dashboards much better than they are right now. The other one is, of course, seeking new partnerships, because in the refugee camp, refugee setting, the partnership aspect comes out really strongly, and it's something that we're looking to do as one of our very immediate next steps.
Yeah, I think that you said that you were covering right now 2,000, and I didn't get if that was the refugee population of 2,000 or 2,000 households. And the question is, are you hoping to scale to the full refugee population in that area to achieve kind of universal coverage of VHT connection in that area?
Yes, that's the goal. The goal is to scale up to the full, to cover the entire camp. Right now, the story that I just shared with you was a pilot, but we're looking to scale that up to the whole camp and another site.
Thanks for answering.
I had a question about the supervision that you mentioned being important. What are some of the primary ways that supervision helps, or where you find supervisors are doing a lot of their work with the most impact?
So in terms of supervision, so the VHDs being quite new to the workflows in a digitized form, supervision was important in that regard, because previously how their workflows were organized was that instead of primarily providing care, they were visiting households. So that we kind of changed their mindset from don't just visit the household, but make sure that you actually provide care, supervise that area, and actually go through all workflows, and also try to hit your, try to carry out your tasks. So where it gives us, where it helps is that, like you can see, we have only had about 2 months of data coming in, but we already have 2,000 households. So it's important for us to continue providing that supervision, but I think that's where really it helps, and make sure that we can set targets for them and move all this forward. One of the things that comes up really strongly, especially for IPs in this area, is geolocation. I was wondering if it's possible to co-create products around that with the community, but also engage in translation, because like I said, I know that Kiswahili is a language that's on the list, but the VHDs that we deal with don't actually speak Kiswahili, they speak Lingala, which is a mixture of French and Kiswahili. So translation for us, I'm wondering if someone is embarking on working with us and co-creating on those two aspects.
If it's for the community, I think that's more like, is someone else out there doing the same thing? But as was mentioned, we have more translations for Kiswahili and English and French, but not for local languages that are out of the box. So it's either use the translation capabilities that sounds like already happening, or work with someone else in the community to see where that could be possible or might already be happening.